A very good afternoon to all of you. Today we are going to look into child abuse, and at the end of this lecture, you should be able to answer what child abuse is. You should also be able to answer its prevalence, risk factors, clinical findings, physical findings, and last but not the least, the medical legal aspects of child abuse. So let's get into the chapter. As we all know, child abuse is a global problem. It's not a problem of a certain country, a certain region, a certain continent. It's global. And the problems of child abuse are presented in the forms of infanticide, female genital mutilation, which indeed is a very painful process, and abandonment. These are some of the examples of child abuse, and there are a few others. These forms of violence against children, along with others, date back to ancient civilization. But for a long time, the issue of child abuse was not widely recognized, both by the medical profession as well as general public, until 1962, when this man came into scene. And as you can see in the picture, his name is Dr. C. Henry Kemp, and he was a pediatrician who published the battered child syndrome along with one of his colleagues. And this was the first time after this publication that the issue of child abuse was widely recognized, identified by the medical fraternity as well as the public. And this was also the publication which earned him a nomination for the Nobel Prize. And it is his effort that in today's day, all 50 states of the United States of America have abuse reporting law existing. The World Health Organization has defined child abuse as child abuse or maltreatment constitutes all forms of physical and or emotional ill treatment, sexual abuse, neglect or negligent treatment, or commercial or other exploitation resulting in actual or potential harm to the child's health, survival, development or dignity in the context of a relationship of responsibility, trust, or power. That is quite a tough definition to remember. There is yet another definition, and that is given by Knight's Forensic Pathology, written by Pekka Sokko and Bernard Knight. And this is considered to be the Bible of forensic medicine. And in this, child abuse or battered baby syndrome or non-accidental injury in childhood are the terms used synonymously. And these injuries exist when an infant or child suffers repetitive physical injuries inflicted by a parent or guardian in circumstances that exclude accident. So there are two things that you need to be reminded of. First, the injuries are repetitive in nature. It does not just occur once. There is repetition of the injuries. And second, the accident is excluded in this one. It means the injuries are not as a result of an accident. So there are a few types of child abuse in this slide. The first one being the physical abuse. And physical abuse is the act of commission by a caregiver that cause actual harm or have the potential for harm. And if you look into the first picture, you can see the child has sustained some injuries in the face, and it is quite evident. And this is a form of physical injury. Second one being the sexual abuse, which is defined as those acts where a caregiver uses a child for sexual gratification, and it is not necessary that it has to be a female child always. It can be either a male or a female child or both. Third one being emotional abuse. It is a failure of a caregiver or a parent or a guardian to provide a supportive environment, and this can have an adverse effect on emotional health and development of the child. The child in this picture, as you can see, is being called with a lot of names. He is bad, he is stupid, he is lazy, and he is dumb. And it might look very trivial, but these kinds of demeaning comments play a very vital role in the psychological development of a child, and this is a form of non-physical hostile treatment. The last one being neglect. Now, here what neglect means is that it is a failure of a parent to provide for the development of the child. It is a failure to provide, not in the absence of resources, but even if the child, if the parent or the guardian is able to deliver, even if he or she has the resources, he or she is not being able to deliver to the child. Now, it involves one or more areas like health, education, nutrition, shelter, and safe living conditions. Talking about neglect, you will have to differentiate neglect from poverty. Now, what is the main difference? Neglect is far different from poverty. Neglect can occur in cases where reasonable resources are available to the family or caregiver, but when a person is poor, he just does not have the resources in the first place. So this is the main difference between neglect and poverty. How common is child abuse? According to the World Health Organization, there were an estimated 57,000 deaths attributed to homicide among children under 15 years of age in 2000, and nearly 700,000 children are abused in the United States annually. The last data states that an estimated 683,000 children were victims of abuse and neglect in the year 2015. And what is the scenario in our country? No official or reliable record or data is available in our country, but an organization called STEVEN, or Child Workers in Nepal, as it is commonly known, conducted a study from January to June 2008, and their study concluded that 3554 cases of different types of child abuse were um, present in our country. It might just be the tip of the iceberg, and the real data might have gone far too up since it was data collected in 2008. Um, Sadly, we do not have quite an updated form of this data. What are the risk factors for a child to be abused? First is the age. The vulnerability to abuse depends in part on a child's age. Fatal cases of physical abuse are found largely among young infants. In most countries, girls are at higher risk than boys for infanticide, sexual abuse, and forced prostitution. The physically abusive parents are more likely to be young, single, poor, and unemployed. These kinds of parents are at higher risk for using violence towards their children. The family size and household composition is also one of the risk factors. When the parents have personality and behavioral disorders, these parents are more likely to abuse their children physically as they have low self-esteem, poor control of the impulse, and have mental health issues. Prior history of abuse is also one of the risk factors. Um, Violence in home is quite common in our country. Domestic violence is very common, and the occurrence of these kinds of violences in the home doubles the risk of child abuse, according to the studies. Now, looking into the medical legal aspects, there are a range of injuries in child abuse, not only clinically, but also in the medical legal aspect or scenario. These injuries, as a result of child abuse, can go undiagnosed. And sometimes the children are not of the age, even if they end up in the clinic or the hospital, these children are not of the age that they can talk. And sometimes, even if they can talk or are at the age of being able to talk, they are threatened not to talk. So, as doctors, it becomes our duty to perform a thorough examination in children with injuries. And there goes a saying, the skin and bones tell a story which the child is either too young or too frightened to tell. So, what do we find? Surface bruising. So, bruising is found around the limbs, especially the wrist and forearms, upper arms, thighs, and in small infants around the ankles. And these bruises can be of any size or type, but a common variety in child abuse is the small, discoid, disc-like, discoid lesions about 1 to 2 centimeter in diameter, and these were once called sixpenny bruises from the size of coins at that time. So this is the sixpenny coin, and these bruises have been compared to these coins as the size of the coins resemble the bruise. Sorry, the bruise resemble the size of the coin, and these are caused by impact or pressure from the finger pads of the adults. These kinds of bruises are caused by the finger pads of the adults. We can also see bruises on the buttocks and the cheeks, as you can see in this picture. She might have been slapped with a great force to have produced these kinds of bruises or contusions, linear ones on the face. And this is also another example of bruising in child abuse, which is quite extensive in this picture. Now, the age of bruise is very important. The aging has to be done. It is very important. There are two reasons why. The first one being the observed age may be at variance with the history given by a parent, so increasing the suspicion of a non-accidental event. Guardianले parentsले एक थोड़ी history दिइराखेको छ, but then the age of the bruise do not match with the history given. Your circumstances, you have to suspect of child abuse. Second one, the bruises of different age indicated episodes of injury at different times. Bruise हेरेर चाहिँ हामीले त्यसको age निकाल्न सक्छौँ है. So when you look into a body of a child and you find bruises of different ages, you have to conclude that the child is being abused over a period of time. एकचोटिमा inflict भएको injury होइन कि these injuries are repeatedly भनेर चाहिँ नि you have to understand. So these are the reasons why the age of the bruise need to be determined. Skeletal damage is also quite common in child abuse, especially in the form of skull fracture. If you look into this picture, this is an indented fracture, which is also called a Pons fracture. The second picture is the radiological presentation of the fracture of the skull. Now, skull fracture are common in fetal child abuse, often in association with intracranial hemorrhage, which is usually subdural hemorrhage. And radiological examination is absolutely necessary. And the most common fracture which lies in the skull is in the occipitoparital area of the child. Limb fractures are also very common, and these provide some of the most characteristic signs of child abuse, as injuries are common around the metaphysis and epiphysis of the growing bones, and most injuries are indirect. Indirect भनेपछि चाहिँ direct blow or impact बाट होइन कि, which is caused by stresses from torsion or traction. So, looking to this X-ray, you'll find the left femur being fractured in this child. The shaft of the femur is fractured. So if you do not perform a radiological examination in these cases, these findings might just go undiagnosed. So head injury is also very common. The most common cause of death in abused children is intracranial damage with or without skull fracture. The classic injury associated with the battered children is subdural hemorrhage. Now, when you talk about the head injuries in child abuse, you have to know the term shaken baby syndrome. What is a shaken baby syndrome? Now, when you look into this picture, you can see somebody is holding the child by the chest, sometimes by the arms bilaterally. And now what they do is they move the child violently to and fro, or very potentially, So as a result, what happens is there's bleeding in the intracranial space. Now, why does this happen? Shaken baby syndrome is a form of child abuse that causes severe brain damage, and it can result from as little as 5 seconds of shaking. 5 seconds मात्र यसरी shake गर्दाखेरि पनि you have the result. Now, what happens is the babies have soft brains and weak neck muscles, and they also have delicate blood vessels. Now, shaking a baby or a young child can cause their brain to be repeatedly hitting the inside of the skull. You can see in these pictures. When the baby is coming in forward direction, the front of the brain is hitting the skull, and the back of the brain is hitting the occipital region. Now, this impact can trigger bruising or bleeding of the brain. So this is what shaken baby syndrome is. Damage to ears, eyes, and mouth can also occur. Direct violence to the head and shaking can cause bleeding into the vitreous humor of the eye, dislocation of lens, retinal detachment, and retinal hemorrhages. The second picture is about the tear of the frenulum. This child might have been slapped across the face, during the process of which the frenulum of the lower lip has been lacerated, and you can find injuries if you turn over the lip. Burns are also quite common. This is an example of a burn caused by a cigarette. It's usually seen in the areas which are exposed. Bite marks are also quite common. As you can see in this one, you have 3 bite marks in the medial aspect of the thigh. Now, damage to internal organs are almost always confined to the abdomen, as the heart and lungs are rarely injured because of the ribs. You know, in the abdominal organs, the liver is frequently injured, and after liver, the small intestine is the other common target. Um, the duodenum and jejunum being the most frequent site of damage. Now, why do they get damaged so frequently? Now, what happens is this part gets compressed between the anterior abdominal wall and the promontory of the lumbar spine. So, when these two areas compress, the duodenum and the jejunum, injuries are bound to be seen there. Other injuries in child abuse include alopecia when there is a violent pulling of the hair, and this is the picture in summary of what we have discussed already. You can find various kinds of injuries in these pictures. When we talk about child abuse, we also have to know Munchausen syndrome by proxy, or which is also known as MSBP. Now, what is MSBP? It is a mental health problem in which the caregiver makes up or causes an illness or injury. So the caregiver makes up for causes an illness or injury in a person under his or her care. And this kind of relationship is usually seen between the mother and the child. Now, what happens in here is the caregiver may lie about the child's symptoms. He or she might also change test results to make the child appear to be ill. And physical harm may be inflicted upon the child to produce symptoms. And what causes it? The cause of Munchausen syndrome by proxy is very unclear, but it may be linked to problems in abuser's childhood and also attention-seeking behavior in part of the abuser. A person with NSBP often has medical skills or experience. He seems devoted to his or her child, looks for sympathy or attention, and when he comes to the hospital, he or she tries way too hard to become close and friendly with medical staff, needs to feel powerful and in control, does not see his behavior as harmful. How do we diagnose this? A child has repeated or unusual illness and no reason can be found. This might be one of the best indicators of Munchausen syndrome by proxy. The second one is the child doesn't get better even with treatments that should help. The symptoms can only occur when the caregiver is with the child. The other parent is not involved in the child's treatment, even if the condition is serious. When the tests come normal, goes on IU and the tests are done and it comes out normal, the parent is not happy. He or she is not going to be happy and he is not assured. And the caregiver is seen harming the child. And another child in the family has unexpected and death or illness. So these are some of the factors that you can sum up and come up with a diagnosis of Munchausen syndrome by proxy. For treatment, the child has to be moved away from the custody of the parent or the caregiver immediately and monitor the child for symptoms. Counseling for a long time may be needed by child protective services, law enforcement, and doctors to these people. They first may resist treatment and deny that there is a problem in the first place. Sometimes medicines are used when the caregiver has other health problems such as anxiety disorder along with MSDP. So, Munchausen syndrome by proxy and Munchausen syndrome um, have to be differentiated. The Munchausen syndrome by proxy is the guardian or the caregiver harming the child. Munchausen syndrome is a mental disorder in which the person repeatedly and deliberately acts as if he or she has a physical or mental illness, that is faking illness, right? Duitaको बिचमा पनि difference थाहा हुनुपर्छ है त. So how do you examine the person comes for autopsy examination? Seeing visit is helpful always. The child should be examined in its original clothing where possible. Hospital and if any maneuvers or interventions have been done, it has to be recorded. Resuscitatory attempt you have to make note of it. For example, CPRs can produce bruises on the chest and sometimes the abdomen also. Radiological schedule survey, full. Now, extensive dissection of subcutaneous tissues is needed because sometimes the bruises may only be visible on dissection. Samples of blood, urine, stomach contents, liver, ocular fluid, and CSF must be taken. Skin samples for fibroblast culture and swabs for microbiological culture can be taken. Blood samples for grouping and other blood characteristics may be needed, and a sufficient amount for DNA testing should be taken. If there are bite marks, swabs can be collected from the bite mark regions. If there is suspected or obvious brain damage, it has to be fixed in the formalin first before being dissected. Wet cutting भनेको चाहिँ नि फिक्स formalinमा फिक्स गर्नुभन्दा अगाडिको fresh brainमा चाहिँ नि the autopsy examination should not be done. Globes of both eyes should be removed for histological examination. And coming to the consequences of child abuse, now it's a health burden because psychiatric disorders and suicidal behavior are some of the health consequences that forms a significant portion of the global burden of disease. Next being the physical consequences, which results in brain, abdominal, thoracic injuries or trauma and fractures. Sexual consequences include reproductive health problems and unwanted pregnancies in cases of sexual assault. Psychological and behavioral consequences can also occur in the form of alcohol and drug abuse, depression, anxiety, and post-traumatic stress disorder. So how do you prevent it? Mostly what we have seen in our country and maybe worldwide also, child abuse victims are the main focus, but the focus is shifted from preventing it. Prevention धेरै focus गरिराखेको हुँदैन. So how do you prevent it? Training in parenting is one of the most important factors. होइन बच्चा कसरी हुर्काउने भन्ने पनि ट्रेनिङ दिन पर्यो. And these programs generally educate parents on child development and help them improve their skills in managing their children's behavior. And this can be a preventive measure. In part of doctors or healthcare professionals, screening गर्नु पर्यो है. Whenever you suspect of a child abuse, you have to screen them without fail. Training. You have to train the health professionals so that they are able to screen them. Right? So when the patients come to you, you also have to be the best judge, and you have to have a better assessment and monitoring. And even if you have all three of these, if you do not have a better response systems, then it is kind of a failure, because if you suspect a child abuse case, you have to report to the police, you have to report to the organizations which look after these abused children. Policy development. And better data in part of the government is also equally necessary. Having said that, we have come to the end of this lecture. I hope it was a good one. Thank you.